Hello, good evening. How you day? The time now 7:44 p.m. Today na the 1st of March 2023. How far? How are you? Now, if you dey watch this video, maybe we don't end the live stream and you dey watch. I no go fit respond to you. It means say we don't finish the live. So I better look your time. But right now, I dey live and I know say people dey wey dey watch me. If you dey watch me and you dey hear me, tell me where you dey watch me from. That's number one. Number two, I notice say people dey always ask for my number on this live stream. Abeg, I need your number. Sorry, I no dey give number. I beg. Yeah, no vex. But if you wan chat with me, click the link for my profile. We go chat. I see say we get a lot of people already online. So make we just talk quickly. Abeg, before I start to take your comments, share the live stream. Share the live stream. We move. Yeah, forget. Well, we move. We move. Share the live stream. Click on the like button. Abeg, share the live. Del Pat say she dey watch us from Dubai. Hmm. Oh yeah, make una tell me where na dey watch me from. Chibuike. Yeah, we move. Grace. I know that name. Where you dey watch me from? From Lagos. From Enugu State. So I won't just spend about 15 minutes here. I'm watching from Port Harcourt, Rivers. Adelina Jumbo, how are you? Oh yeah, make una tell me. Ifeanacho, how far? Felicia, so. Did I get it right? Yeah, where you dey watch me from? Let's go. So I did live on Facebook, my two Facebook pages. I did live for YouTube. Um, Somebody says, I have something to ask you. Okay, yeah, they ask them for here. Latifa Satellites, watching from Canada. George is from Canada. How Canada they? So I did live for Facebook and I did live for my YouTube page. So wherever you dey watch me from, drop your questions. We could just do about 15 minutes for here and then I disappear. Uh-huh. I beg, share the live, ladies and gentlemen. See something. People know people know they show love for this live stream. People know they show love at all for this page. Ah, we go beg, share live. We go beg. People no go share. Ah, God, doctor, is it good? Anytime I'm seeing my period, my stomach runs like frequent stool. Always when I'm on my period. Grace, if this thing dey happen to you every time you dey on your period, na your body be that. Full stop. Some women dey whenever they dey their period, they go dey fall sick. Some go tell you say belle dey turn them, they go to toilet. Maybe na so your own be. After your period, the thing dey stop. Okay. But if you know say this thing come dey serious too much, abeg, see doctor. Abeg, make nobody ask me for medication. Make nobody ask me for treatment online. Make nobody ask me for diagnosis. I beg, we no dey do am. If you want make I explain something for you, I go explain. But if you ask me which medicine can I take, I dey get this problem, which drug make I go buy, I beg, I no go respond to your comment. What is the difference between fertile period and ovulation? Ah, Ifeanacho, you know they watch my video. I know this name now. Um, After I don't make video on this, see, ovulation. Oh God, ovulation now when your body release egg. I feel sad. You know why I feel sad? Because we don't talk this thing over and over and over again, and the video day. Ovulation now when your ovary release egg, you don't ovulate. Fertile period, fertile period na that period, that time wey dey near your ovulation. Fertile period na the time wey dey near your ovulation, meaning say you go soon ovulate. Meaning say if you meet your partner, you fit carry belle because sperm, anyhow that they pronounce them, sperm fit survive inside you even before you ovulate. So the sperm go dey inside your body dey wait for the egg to come out. So na make am fertile period, fertile window. Ovulation na say you go release egg. Fertile window na say you don dey near. Na that time wey you dey near your ovulation. Shey you get? Is it clear now? Oya, make una share, make una share, make una share, share, share. Don't forget to send stars on this page. Ladies and gentlemen, send stars. That is how you encourage this ministry. I'm doing great. Yeah. Good evening. Okay, yes. Okay, good. I'm getting pain side of my ribs. You're having pains at the sides of your rib. This thing you've said right now is just it's nowhere. Because I don't even know how to advise you right now. Pain side of your ribs. What have you done? What have you taken? Can a mild ovarian cyst make one not to get pregnant? Unlikely. Women we don't carry belly and then get ovarian cyst. Thanks. Just during the period after it stopped. Okay, good, good, good. How is work going? Work is doing very well. Helen, how are you? I understand now. Very good. Queen, hello, doc. Can I get pregnant after abortion? Yes, you can get pregnant, Queen. So, Queen is watching us from YouTube. Ladies and gentlemen, make una share. If you don't share, drop and down. Tell me, say I don't share. I noticed something that because you see this live now support. Ladies and gentlemen, now support. Make una support this guy here by sharing the live. Huh? I beg. So you can get pregnant, madam. You feel born after abortion. But the thing they say, we know they advise ladies to dey do abortion. Though. Eh? So if you know say you do abortion and then do am well for you, no complication, no problem. Yes, you go get belle, you go born. But if you go do abortion for the wrong place, person wey no sabi work do abortion for you, abeg go and see a doctor, make dem check you, make dem find out say everything dey okay. Do you understand? Oma, good evening. Hi, Adeyemi says my cycle is 25 days, but since 3 to 4 months now, I've been seeing it on 23rd day. It's now 23 days, Abi. Am I okay? You have been seeing your cycle is now 23 days. It's no longer 25 days. Madam, you are still okay now. Ladies and gentlemen, the video dey this page. It's like I will reshare that video. How to calculate the length of your menstrual cycle. 23 days is still normal. 23 days is still normal. It dey normal. So you no need to dey panic. 23 days na still normal. 21, 22, 23, 24, 25, 26, up to 35 is still normal. Okay, Felicia, you have not taken anything. Okay. If the pain is so bad, basically, wetin I go advise you online, they say you can take your pain relief. This is in quotes. But if you take your pain relief and yet the pain still dey, I beg, see your doctor. Is that okay? Hope is asking us a question. Hope say, please, my 4-year-old child doesn't like eating food. As of yesterday, her height was 108 centimeters and 15.5 kg. And she looks really slim. I am feeling she's malnourished. What do you advise I do to her? So we have to be sure, say this pikin, this pikin dey malnourished. And no be by looking, it gets standard wey dey check. We dey call am weight for height or age for height. E get how we dey check am. Na only doctor fit check am for you. So they go check whether this pikin for the age the pikin get the normal height. They go check for this pikin age, this pikin get the normal weight. If the pikin no dey within the normal weight or the normal height for that age, they go tell you say, ah, madam, your pikin is not taking the right nutrient, your pikin no dey grow well. Does that make sense? Hope. Madam, do you understand? Eh? Yes, na so the matter be. So you can't just look at the child and say this pikin dey malnourished, even though we get the eye assessment, but medically you go need to dey sure. Yeah, Agbesi, good evening. Well done and keep the good work. Thank you very much. Good evening. Thank you. No be this kind star or make una send me, not this kind of star. Thank you. Please, what is fatty liver? Just go to Google, Joy. Just go to Google and type fatty liver. Yeah, I beg. No vex. I beg. Just go to Google, type fatty liver, and begin to read. You go tire. FA. How many more minutes do I have here? I have about 10 more minutes. Make una share. Ladies and gentlemen, share. FA say I saw on Facebook that a woman can get pregnant for two men at the same time. How true is that? Yes, it dey happen, but it dey rare. Many things dey wey you never hear for your life for medicine. Many things dey wey you no go ever hear till you die. That does not mean that those things are false. Then they happen. Yes, a woman fit get pregnant for one man. As she dey pregnant, she go carry belle again, go born, go get twins, and that twins go be for two different fathers. So this thing don happen, but e no dey common o. E dey very very rare. Yes. So with the woman go ovulate, she go release one egg. The man go fertilize. She go ovulate again, which is not supposed to happen. Which is not supposed to happen. She go ovulate again, and if she meet another man, go carry belle, and she go get twins. But the twins na two different men get am. Okay, no more comments, no more questions. Na these questions wey I dey get for my video na im make me dey come online. And when I come online, I no go see questions. After I don end the live stream, you go come see people dey ask me questions. Now I dey live, abeg, biko, joor, don't wan la, whoa, whoa, ask me your questions. Yeah, thanks for the explanation. You're welcome. Okay. Oya o. Oya o. Oya o. Hi. Frank Vivian. AB. Which AB be this? Which AB be this? Which AB? Okay, so ask your questions. I make I come online, I just talk small and then I disappear. You get. I beg. May nobody ask for my WhatsApp number. You get. I beg. I know they give my WhatsApp number. Yeah, no vex. If you want follow me chat, if you really 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 want follow me chat, I beg. Link dey my page. No be for the comment section. Do not click on any link to private chat me from the comment section. The link to chat with me privately, you go book for that private consultation, abeg. E dey my page, my profile. Click am so that make nobody go scam you, give you link for comment. You go follow the person chat. No be me be that. Shey you get? I see na only one person don share this live since. Only one. Omo, I don try. I guess it's time to start. I guess it's time to clear. What is the side effect of eating too much red meat? What is the side effect of eating too much red meat? So too much red meat is not good for certain age and above, and also red meat has been linked to colorectal cancer. What is the risk of low blood pressure? There's a video of low blood pressure on my page. I don't do video. There's nothing like risk of low blood pressure. Your question is not clear. What is the risk, as in how, of low blood pressure? What is the risk of low blood pressure? Or what are the complications? Now that one you dey ask me, what will be the complication of low blood pressure? Say I go they turn you, I go they turn you, go they feel tired every time. You know, get energy. Basically, you know, go fit do things where you want to do because your BP is low. I made a video on this. The video day for YouTube, day Facebook. I beg, try watch them. What are the signs of a woman without a uterus? You fit no know. You fit no know. Full stop. One sign they say maybe she fit know she go dey find out how to get belle, or she fit know dey menstruate, or you fit no even know at all. If you just dey come to my page, abeg, if you just dey come to my page, abeg, I no dey prescribe medicine, I no dey treat here, and I just explain. So I no dey make diagnosis here, so that in case you get medical problem, you dey find the answer for here. I beg you, I go always beg you, make you go hospital. This place no be substitute for hospital. I think I really need to end the live stream this night. I know they encourage again. The people wey dey watch this live, let's see. People wey dey watch this live no dey even share. See now, only one person for this particular page, official. Only one. Na im don share. I don't die. God forbid. I will not die in Jesus' name. But it's not encouraging, guys. I'm having chest and something back pain. Please kindly help with the cause and solution. We don't do that, madam. I don't know what is causing your chest pain and your back pain. There are many things that can cause you chest pain. There are many things that can cause you back pain. Chest pain can be from, say, maybe you fall, you carry something heavy, or you get pain from your lungs, or you get pain from your ribs, or you get pain from your heart, eh? Or you get your pleural, and they surround your lungs. So many things they will give you chest pain. Do you understand? I know if you tell you now this thing they cause your chest pain. So I don't even get the solution for you. The solution they say, if you know say this thing they really really disturb you, chest pain, it just started few days, maybe today or yesterday. Monitor them. Take pain relief. I'd always talk them. You can take your analgesics, over the counter medications, no problem. Watch them. But if you know, say you don't take your analgesics, the thing no go, it still they disturb you, or this pain don't dey there for a very long time, see a medical doctor. Is that okay? Uh, I'm always feeling tired and also having constant headache. I've treated malaria and typhoid. Who sent you to treat malaria and typhoid? Who sent you, Vivian? Headache, tiredness, it does not mean you have malaria, does not mean you have typhoid. So you are treating the wrong thing, Vivian. Simple. Huh? You're treating the wrong thing. And like I always tell you that this place no be clinic. So the constant headache, feeling tired, who told you that this is malaria or this is typhoid? Who gave you the diagnosis? Now this is why we get so pained and angry. People will just wake up, will just they treat themselves. Madam, you might be treating the wrong thing. You might be treating the wrong thing. So no be malaria you get, no be typhoid you get, or you know they treat them well. This is where you need to speak with a medical professional, and that is why we are here to guide you. I'm not going to prescribe anything for you because I don't even know what you have. But if you know, say, you know they sleep, you know, say they very stressed, the headache has always been there, you dey always feel tired. Um, come stop whatever medication you are taking and let a medical doctor, I mean a medical doctor, please see you. That is the best advice I can give to you. On social media, for fatty liver, Joy, go and read about fatty liver. Fatty liver, basically, in the simple English, unless I go make video for this one later. But fatty liver means say fat gather your liver, fat gather your liver, fat full inside your liver, abnormal, and e get many causes. Yeah, read about it on Google. Don't worry, just read about it. How do I use folic acid? Please, I mean prescription. Why do you want to use folic acid, madam? We need to know why you want to use folic acid. You don't watch my video on folic acid. Why do you want to use folic Why do you want to use folic acid? Please. There are reasons to use folic acid. I made a video on that. Hmm? I made a video on that. You don't watch them. Sorry, guys. You don't watch the video. So there has to be a reason, first of all. Have you watched the video on folic acid? Ife, my son is looking pale. What can I do? Oh God, your son is looking pale. Are you sure your son is indeed pale? If you feel your son is pale, okay, tell me the reason, madam. They see there are reasons. I don't just know how to use it. Okay, you don't know how to use the folic acid. You've watched the video. Okay, I have watched it. Good. So the folic acid is a small tablet, one tablet a day. One a day. Full stop. Full stop. One a day. Yep. So your son is looking pale. If your son is pale about a day, you have to know why your waiting they make your son pale. If indeed your son is pale, you might feel your son is pale, whereas your son is not pale. Hmm? Your son might not be pale, oh, madam. Suddenly change does not mean your son is pale. This is why I don't know where you are. I don't know if you have anybody that cannot help you examine your son to be sure if your son is pale. Because he get what your doctor go look out for. He get what the doctor go look out for that pikin body to confirm if indeed the pikin dey pale. And then if we can suspect say this pikin dey pale, then we can send you make you go do test to confirm true if the pikin dey pale. You understand? So no be to just say my son is pale, what can I do? You have to be sure that this is what it is, what exactly is causing it, and then what to do. Thank you so much. God bless you. Good evening. God bless you too. Please, what causes pain in woman's pelvis 1 month after delivery? What causes pain? It could be from her delivery. It could be from her delivery matter. It could be, oh, it could maybe. I'm not sure, yeah, but it could be, or it could be something else. When a woman give birth, sometimes some women they get little pains depending on the mode of delivery, whether not vaginal delivery or cesarean section, depending. If it be from the delivery, if it be something else. So this is what you will advise the woman. For women, you always encourage them, say after them deliver like this, that period, 6 weeks after delivery, they go for checkup, they go check out to be sure say everything they fine. If the woman no born for hospital, she born for house. My advice is let her go to the hospital immediately. Do you understand? Eh? But if you born for hospital, then check out everything is fine, and make she calm down, make she not to panic. It will be the process of postpartum. I want to end this live stream right now. I want to end this live stream. I want to end this live stream after eating or anytime, please. So, Ife Oluwa, the reason I'm responding to you is because it is folic acid. Do you understand? And we encourage women to take folic acid. And you said you are taking it for a good reason, Abby. So this is why I'm responding to you. Normally, we know they talk about medications like that online. Sure, you get. But for folic acid, you can take your folic acid anytime, anytime. Whether you want to take them before you eat, whether you want to take them after you eat, whether you want to take them in the morning, in the afternoon, but ensure say you take them every day. You understand? And because na folic acid, now make we dey discuss like this. But if na other medication, we no go talk about them online. You get? uh Adeyemi, my friend is having a serious issue and having a baby. But when they went to hospital, the doctor said her VG is very tight. And when she narrated her story to me, she said her finger can't go inside her VG. I don't understand. She's having an issue getting a baby. That is one. The VG is tight. But she dey knack now. I mean, she know dey knack. So how she take the knack? I don't understand. What do you mean by she's having issues having a baby? Or she no fit knack at all? So this story you are giving us might not be the true picture of what your friend they go through. There might be something else you don't really know. So I go advise you make because you don't know exact story. If she say she dey get problem to get belle, e mean say she dey knack, abi? Clear. But if you talk say finger no fit enter inside, meaning say she no dey knack. So if she no dey knack, there is no way belle go enter. I don't know if wetin I dey talk make sense. I'm trying to be as simple and plain as possible. E clear to you? Na only when woman dey knack, she dey knack, belle no dey enter, we talk say, oh, she's having issues conceiving. But if she no dey knack, blockers no fit enter inside, how she go take get belle? So you need to really understand wetin your friend dey go through. eh or if you really love your friend so much and your friend trust you so much, you fit follow your friend go hospital if she go permit you, make una two go, make dem really explain wetin dey happen. You get? I'm not trying to say you are saying rubbish, oh, but maybe you no understand the clear story of your friend, and maybe you no understand them, or maybe wetin dem tell your friend also no really understand wetin dem tell am. Yes. Dimpa Glow, ladies and gentlemen, I want to end this live stream right now. I don't try. For one of my Facebook page, now only one person shared this live. Only one. Only one person. God, I beg. Somebody says, Doctor, please, how can one get over health anxiety? Secondly, I've been overthinking recently and affecting me. Okay, Vivian AD, help me understand. What do you mean by health anxiety? Or are you having anxiety? Like you get anxiety disorder, your mind dey always worry, you dey worry, any small thing, you dey panic, that one different, or you just dey worry excessively. Eh? Yes. Or you get wetin happen to you, wey come make you dey carry get this problem. E dey happen to people. Get wetin we dey call anxiety disorder, get wetin we dey call panic disorder, panic attack. E dey happen to people. Sometimes e fit be say maybe when the person dey grow up, get wetin happen to the person from small, or as the person don grow up, get events wey happen to you, eh, wey make that thing come. Sometimes e no dey come like that. Something dey wey make am come. So you go need to sit down, think, wetin really carry this matter come. Na my work, na my family, na my relationship, na my finance, na accidents, na armed robbery attack. People wey don experience accident or armed robbery attack or the rest, sometimes this thing dey happen to them. So many things dey. You go need to have a one-on-one session with a mental health counselor, a mental health expert, your doctor, to really know wetin dey go on, and then they go help you break am down. Mm, yes. Okay. Now I noticed something, guys. I want to end this live stream. People come to my page. People don't really, really pay attention, guys. There's something going through the screen. People don't read it. People know they read them. They know they read them. They know they read them. Please, guys. These things are information for you, so that make you look like say they ignore your comment or they ignore your request. I see somebody they ask me now, I want to talk to you privately. Another person will talk, say I need your number. Please, guys, especially for those who just follow me, I beg. Now, see, I'd always use the word I beg. I know they do on social media. I know they do the private chat or call me or this. I beg. I see many people go won't follow you talk. I make you not be like say I'd ignore you. If really, 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 really you want follow me talk, link in my page on Facebook, on YouTube, on Instagram. If they there, click on the link. Somebody will follow you chat, they will tell you what to do. I beg, no vex. Yeah, no vex. And they will tell you may you pay. You get. Huh? My sugar test is 7.0. Does that mean I'm diabetic? That does not mean you're diabetic, my dear. You have you that is that does not mean you're diabetic. Full stop. That does not mean you're diabetic. 7.0. So 13 times 7. Hmm? Does not mean you're diabetic. Please. Hmm? Doesn't mean you're diabetic. Okay. Yeah. Okay, ladies and gentlemen, I have to go now. I don't try. I just wanted to spend 30 minutes online and then I disappear. I don't try. So no vex. I can't spend more time here. The time where I give myself for the live stream don't pass. No vex. Yeah. For those where they try send message via mail or the in the inbox or the rest. I'm sorry. You know what to do. Use the link. Thank you so much. I've been dropped one video of recent, I think a few minutes ago. Try watch the video and also help me share the video. God bless every one of you. Thank you for your time. Like I'd always talk. Good life, good life, good life in that sense. Take care of yourself and have a wonderful night. Bye bye.